Okay, so I just received a referral from the doctor to do a swallow screening on a patient. And I have the checklist, and if I check yes for any of the boxes on this checklist, I'm going to have to refer this patient for a full swallow evaluation. I'm reviewing the patient's chart right now, and I'm gonna see if anything stands out. Right now, I'm not seeing anything significant, so that means that I'm not seeing a reports of history of recurrent pneumonia. I'm not seeing a diagnosis of a partial laryngectomy, oral resection, full radiation to the head and neck area. I'm not seeing any anoxia, Parkinson's disease, myasthenia gravis, motor neuron disease, bulbar polio, anterior cervical spinal fusions. I'm not seeing any brainstem strokes. I'm also not seeing any Guillain-Barré or any laryngeal trauma. Along with that, I'm not seeing any trauma to the brain hemispheres or to the brainstem, which would affect the swallow. I'm not seeing any damages to the motor neurons innervating the muscles and the nerves that would affect the swallow, or any structural damages that would affect swallowing. I also don't see reports of prolonged intubation or an emergency tracheostomy. Along with that, I don't see any reports of severe respiratory problems. Okay, so I have my patient here with me today. Okay, hi, how are you?
Good, how are you?
Good, thank you. So I hear that you've been struggling with some of your swallowing.
That's correct. Yeah.
Okay. So I'm just gonna have you answer some questions for me today, and I'm also going to have you swallow something while I observe. If I observe any difficulty or if you report any difficulty on this checklist, then I'm gonna have to refer you for a full swallowing test. Does
Okay.
that sound good?
Yeah.
Okay, so let's get started. Okay, so do you feel like you have a gurgly voice after you swallow?
No.
Okay. What about some coughing before, after, or during your swallow?
No, none of that.
Great. What about do you feel like you have excessive saliva, like drooling?
No. No.
No. Okay. And do you feel like you have like less saliva? So like do you swallow less saliva, like one saliva swallow every 5 minutes, for example?
No.
Okay. What about any noisy breathing during your swallow?
Yeah.
Okay, great. So now I'm actually gonna have you take a drink of water
No. Okay, I can do that.
while I observe your swallow. So if you can go ahead and
Yep, sounds good.
thank you. How do you feel?
Feel good. Yeah.
Great. So with this patient, I did observe some coughing and some throat clearing, but I did not hear any gurgly voice after he took that swallow. I also did not observe any fatigue. I did see the elevation of the larynx while he swallowed, and I did not observe any um, multiple swallows per the bolus. If this was a real screening, I would have stopped it right after I heard that cough and throat clearing, and I would have referred him for a full evaluation. All right, thank you.